This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Welcome back to another episode of Impact Healthcare. And I've got somebody on who I think actually, Ben, you are my first time second guest or second appearance. And Ben and I actually have a really interesting way. We met, 15 years ago and then realized that we had met 15 years ago, 15 years later, but we'll skip that one for another story. So Ben, thanks for being on. And for the audience that might not know Ben Connor Insurance, give us an introduction to you and your great company.
Yeah, so our firm is based out of Indianapolis, Indiana. This year's our 75th year in business, which that's a long time. I have not been there since the beginning. I started about 18 years ago, though, and we're a third-generation family company. We do employee benefits, commercial insurance, personal insurance. So I lead the company, but primarily lead our employee benefits practice as well.
Awesome. So Ben, I know you as an individual, and I know this question is going to produce a good answer. So I feel like people I'm going to put us in the same category. Us wake up with a different fire in our belly. It's easy to do it the normal way. You are anything but normal. So talk to me about what fires you up about this business, about being a change agent. Just what's your why? What fires you up?
Yeah, I've thought about this a lot, and I don't know if I have the exact thing yet, to be honest with you. But I think what I do know is this: I'm a competitor. And when I compete, if I actually go back to sports, my favorite sport's basketball, I was the 5'9", which isn't necessarily helpful in basketball, 5'9" white dude, trying to figure out how to win, and I had to find a different way. I had to think about the game differently, and I learned that really being mentally tough and thinking through how to play the game can produce good results. I think that translates in my profession. I think it also, there's a correlation of in that, I was never the smartest in school, never felt like I was the best looking dude ever. So it was always I'm the underdog. And I think when I look at helping employees, helping frontline workers who work their tails off to support their family, and to think that the healthcare system eats them alive, it drives me crazy and it makes me mad. So I think there is just something there that I just really relate to. Just competition and coming in as the underdog. So
love it. I love it. And I think that your wife and your two beautiful daughters disagree with you're not a handsome man. So we'll ask them that later.
Only needed one, I'm good.
So when we were prepping for this, I think the thing that cropped out in my head is a term that I think about is, if you see the chef walking across the street to eat their dinner, you're probably questioning how good the restaurant is. And you are somebody that practices what you preach, and you use the term performance lab, that you as an agency, when you're having conversations with employers about strategies, you do it for yourself first. And now you're able to undo it, tinker with it, see the thing. You're going to get employee feedback because your name's on the door. I mean, all of that. Talk to me about just that mindset of practicing what you preach, because Yeah, I see some stats. Best places to work 9 years in a row, healthiest employer. I mean, and this is either when we're talking about Indiana or worldwide, not worldwide, but US wide, most innovative broker. I mean, you are someone that gets out of bed and says, don't listen to me, watch me. Talk to me about that mentality.
Yeah, I think, well, thankfully, and we might laugh about my statistics about big enough, but thankfully, as our company has grown, it's allowed us to have opportunity to really get ourselves into a situation where we're practicing what we preach, where our health plan can be our own performance lab. And quite honestly, as you're listing off those awards just now, one actually came to mind that's actually probably one of my favorites, is we won, and this year will be our second year to win a Rosie Award, top health plan in America. And we have 35 people on our plan, and we're self-funded. And so we have over 50 people, 35 or so on the plan. But we wanted to build a health plan where we get to see what our employers experience from our recommendations. It's really easy to say, hey, in theory, you should be doing all of these things because it's the right thing to do, or it's the right, it's the right mousetrap. It's a whole nother thing to experience it and to actually put your own company through that and see the results of that. Because I'll tell you this, as a broker, you do get involved in employers' businesses fairly deeply as an outside party. But I will say this, when employers get feedback from their employees will either go to a supervisor, they'll either not say anything at all, or maybe something gets to HR and then gets answered and sent back down. None of that gets to the broker. But when that health plan is your own company, you deal with it. And hopefully we're creating an environment where we don't have instances where our employees just don't say anything, that they're actually saying, hey, I have questions about that and I need help, because that's the only way we're going to make changes if we're all doing it, right? So I don't know. It was an interesting opportunity for us. And thankfully, my leadership team, along with me, was eager to take on the challenge and has really applied themselves to trying to understand how it works and pushing for positive change.
So I'd like to take that and break it up into a couple pieces. One, I'd love for, in whichever order you want, you're the guest. What are you doing? So like, hey, what is it? Hey, we won this award. We're doing some cool things. What are you doing? That's one vertical I want to go down. Obviously the results. So, hey, what wins you these awards? And then I want you to flip that conversation and then say, you're sitting in front of employers all day long and translate that conversation that if you were sitting in front of a whole bunch of employers and you're giving them, the talk, like, hey, I've been in this situation. I've only got 35 employees. So all of those debunking of myths, we're not big enough, you've overcome them yourselves. So maybe let's start, if you don't mind, like, hey, what are you guys doing? What has been the results? And then let's translate that into adding value for people listening that would be like, hey, let's break that conversation down of how maybe people that are sitting in your shoes as an employer should be thinking.
Yeah. I'll try to navigate this so it's digestible. So first and foremost, just to tell you what we're doing, we thought it was important to get on a self-funding chassis. We are in a reference-based pricing model, which we believe is not a means to an end. And this is another thing we say, there's no silver bullets. We just have bullets. Okay. So if you have enough bullets, you can start firing away and get things happen. So we're on a self-funded chassis doing reference-based pricing. Reference-based pricing just gives us the ecosystem, the fertile ground where we can plug the things in that we want to plug in that can deliver the results that we ultimately want to have delivered. So from that, we have some direct contracting pieces in place for our in our community so that people can access care without fear of of balanced billing. They can go anywhere they want still, but they know that there's some safe havens through these direct contracts. We have a awesome bundled surgical, like ambulatory surgical center in Indianapolis that is kind of the 2.0 version of Surgery Center of Oklahoma. So we put money in our employees' HSA accounts if they go there. And we want to make sure that we incent that. We also have independent medical management in place that is watching over the plan on our behalf and give our workforce sound counsel, not only like while they're trying to pre-certify whatever, but ahead of time if something is occurring. So they've done a really good job for us, and we've really figured out how to adjust the dials on that service so it's perfect for us, which I think that is there's an advisor antidote right there. So we've done that. And then we've also just, when we found some interesting things, we've plugged it in. So we have a partnership we developed with a physical therapist in town that specializes in just really helping people with MSK pain and trying to solve that. So we're not going in for unnecessary surgeries if it can be solved through like really next level type thinking around physical therapy for musculoskeletal issues. Contractually, we really kind of own the idea of our own plan document. We want it to operate how we want it to do. So that means we're inside of like how we want medications to run, what our formulary looks like for our PBM. We have a pharmacy consultant that we have a great relationship with, so that we have that program on continuous improvement. So, I think the next things for us that we're looking into is for us, how do we effectively solve for primary care in a way that we want to solve for it? So that's on the roadmap for us internally. That's what we want to do. And I think, so that's the what. Hey, this is what we're doing. I probably forgot a couple things, but that's what we're doing. But the how is the same across the board. It doesn't matter if you're Coca-Cola or if you're Connor Insurance. It started with our leadership team saying, hey, we can address this. We're of the size we actually can start addressing this. And this is the reason why I think we should do it. This is the reason, not only can we be efficient in managing our supply chain, we can care for our employees much better than they're being cared for now. And our team was all about that, knowing that it wasn't going to be easy, and it hasn't been easy. But what it's allowed us to do is we've reduced the deductible level for our employees. We're a professional services firm, so we are on a high deductible health plan because we think that's the right choice for our firm based off income levels and ability to contribute to an HSA. But we reduced our deductible to the government minimum requirements for a high deductible health plan because we've asked our employees to go through this process with us, to walk through it with us. So we know that we offer the best health plan that our employees can get when they look at the competitors in our market. And we're doing the right fiduciary act on their behalf. And we're giving them tools to be successful in accessing healthcare.
I've got 9 billion ways I want to take this, but I need to first go and say the results. So because I want to go with the results. It says, hey, obviously we talked about all this stuff. We're going to cover the results. And then I want to dig into like 3 areas that I think people need to hear about. So what has that been the results? And I want you to hit results financially for the organization, financially, and how they like it, the members themselves. So I want you to hit results on both of those ends.
Yeah. So financially, we're still below our starting point. That was 2 years ago. So we're good there. We're looking to make more investment into that, into our plan financially. So, we're off the rat race of talking about trend, and we're talking about, health investment. So that's that. I think from a results perspective for employees, it's difficult. I mean, 2/3 of our headcount is not employee benefits. So, just as much as a benefits broker knows about the homeowners forms, HO6 or HO4, that's how much our personal lines folks really delve into the benefits side, and thankfully they dive in. But the results of what we've seen is we have seen countless ways in which our medical management team has really supported some of our workforce through whatever their circumstances have been. So I think that is a huge win. And it's a sustainable financial outcome. Trying to think of some other results that we can particularly talk to.
I'll dive into a couple questions there. So I want to go back and says, hey, you're self-funded at 35 lives. So let's just go there. Obviously you're in the business, but somebody else in your leader, and so you knew that was possible. Somebody else in the leadership team, who's not in the business, you go to and like, hey, here's a great idea. At 35 lives, we used to be with Anthem, whoever you were before. You're in Indianapolis, so I was guessing it was maybe Anthem. And now I want to take a self-funded. What was the immediate pushback? Probably very similar to the pushback that you get when you're having a conversation with an employer. So you're advising on this side to an employer over here because you're wearing both hats.
Yeah. I think an interesting wrinkle, I actually left this out. In that renewal where we switched, we actually had a flat renewal with Anthem. So it would have been so easy to hit renew, baby.
Mail it in.
Keep it going. But we know that in general, especially with larger groups, if you have a flat renewal, that means you should be getting a huge decrease, because we always talk about like, hey, insurance, if somebody's talking about like, self-funding is too risky or whatever, it's always like, all right, here's how it works in health insurance. It's the insurance company looks at you and they think, hey, heads, I win, tails, you lose. So either you have a bad year and I have to raise your rates, or you had a good year, but you're going to have a bad year next year, so I still have to raise your rates. I think we were able to have a good discussion about that in particular. I think what I saw within our leadership team, because again, not everyone is on the healthcare side, is they didn't really know necessarily what questions to ask. So we really had to prepare of like, this is what is going to occur. This is what our expectations should be. But here's the reasons why we think we should be doing this. And since, I could be the biased party of that conversation internally, I did bring in other people from the benefits team that weren't family or ownership. Because obviously, if we save money, I do have a vested interest being an owner of the company. We brought in some other folks that maybe didn't have that same bias to really share what their direct opinions were about that. So I thought that was really helpful. But yeah, so we just had to do education and say why we should do this. But you know what? So we're in our second year with this. I look at what's happening in the market, and I'm really glad that we did it for so many reasons. But one that's really bubbled up that I didn't take as seriously totally out of the gate, but I take super seriously now, is the fiduciary duty I have as a leader, and like how I really can have confidence that I'm taking that responsibility, like, to the extent that it should be taken, to the seriousness of which it should be taken. Which also, like, I can just feel comfortable that I'm like, hey, am I doing the right fiduciary thing? Even when we dig into plan document things of like, how much will we pay for certain services, and what are there circumstances where we could pay too much and that's not in the right in the best interest of our employees, and if so, I need to change that. Thankfully, in the plan that we have now, I can. I'm not strapped by, a network agreement that I don't know about, I can't know about, then they're making decisions on my behalf.
Yeah, love it. Love it. Love it. I want to hit on the medical management and the incentive piece of it too. You had indicated like, hey, it's been really good for the employees, and they've got it. For somebody who's listening and says, I don't really understand what medical management is and what that steerage is, define it. And maybe if there's a specific example that you can draw that has led to positive healthcare outcomes, that would be wonderful.
Yeah. So medical management is simply having a medical team as a part of the health plan, where it can come alongside an employee and make sure that they're getting quality healthcare, and to make sure that the physician is following the path of appropriateness of care. It's easy to think that our doctors know what they're doing, and some of them definitely do, but all of them don't. There are people that graduate at last in their class. Yeah. There are also people that can know a lot about things, but don't know actually how to do it. So we have to be able to put our employees in a position where they can know what the expectation is for their service provider. There are dozens of plumbing companies, and some really stink and some are good. So just like we want to have the good ones that come out to our home to do plumbing, even more so we want to partner with the best doctors that are performing surgery. And it's crazy that's something that we have to be mindful of and try to really fight to give to employees. But that's the essence of medical management. Not to disclose too many personal stories of what we've experienced internally. But we've had a circumstance where we had an employee who's, has a family member that needs some pretty extensive care, and that medical management team really coached that person through it and what questions to ask, how to help. I've had that personally with my family, of some events that we have gone through where we had people in our corner saying, hey, you need to ask that question. If you get put with an on-call surgeon, you need to say no, because that might not be a good doctor. Just some things like that. And when we had another instance where there was we had an employee go through a circumstance, and the doctor really put the fear of God in our employee of something really bad can happen to you if you don't deal with this now. And, as they went through to pre-certify the service, the reasons why they were doing this surgery, not one of them was a clinical reason to actually perform the service. And so you think about that, you're like, oh my gosh, no clinical guidelines are being met in the recommendation for this surgery, and not to talk in too many concentric circles here, but I put myself in our employees' shoes. How confusing. A doctor who they trust says you have to get this surgery done immediately or something really bad's going to happen to you. And an unknown third party, really, of people who really are intended to help you are saying, this doctor is recommending something that has really no clinical foundation. This is alarming. That's a terrible position to be put in. And that's the state of it's the state of our healthcare system, unfortunately.
Well, I mean, to a hammer, everything looks like a nail, right? So if at the end of the day, I can convince you to have this procedure and I make a monetary gain out of it, and let's just say that person didn't wake up in the morning wanting to screw somebody, but maybe in their own judgment, based on the knowledge and skills that they had on that particular day. I try to because it'll throw us down a rabbit hole if we think that people are trying to, be malicious in any nature. So I try to wake up every day and says, everybody's trying with the best tools and best resources and best knowledge that they have on that given day. But in that scenario, to your point, that person probably would have taken that guidance absent of a third-party entity to provide that, because you're scared. Somebody, a trusted professional, doc, one of the highest trusted professions out there, tells me I need to go do something. I'm typically going to go do it. Right. I want to put an employee, so you come out with this medical management company, and somebody on the property casualty side who doesn't necessarily know about HIPAA and all these things says, wait a second, you're my employer. Is this a violation of my private, blah, blah, blah. Talk to me about any of that feedback. And then what's the reality behind, the information you get as now the employer seeing it from that angle?
Yeah. That actually is a great question. Because HIPAA is a real thing, and protecting people's privacy is of utmost importance. So, as we rolled out this plan, we were very, very specific about having someone in the driver's seat internally that can really help our workforce, and that's competent to do that, will keep confidentiality, all those sorts of things. And we've really stuck to that. But the reality is we're a close-knit organization. I know people say that you're not supposed to talk about family in the workplace, and I say, whatever. This is our work family, and things come up, and people say, hey, I need prayer for this. So we know about it. And, so if there is a situation going on that's been made aware, I, as a leader, I think it's, hey, do you mind sharing with me the problems that you're having so that I could be a help to you? And they can say no, and that's fine. And they know that they have our confidential person that they could go to. But really pursuing, in light of that, it's okay, pursuing people to help them solve problems has been very helpful in the adoption of this program, because they know that we're here to help. They know that they can share, like, hey, I got a balance bill. What does this even mean? They told me this. What does that even mean? And we can tell them the truth. This is what's really going on. This is what that really means. We had a circumstance where a pediatrician's office said they wouldn't take our insurance. And so I asked the individual, I said, well, you went for that service last year. Can you go pull the EOB from Anthem? This was last year. Pull the EOB from Anthem to see what they got paid. And so he went and did that and found a comparable bill, and our program paid more than Anthem did, because we pay physicians well. And so he took that back to them, and they said, yeah, but we don't take your insurance. It's like, hey, not now, as someone that's is involved in this program, now what's going on. So we help them walk through how to handle that situation, and let them know that your pediatrician just wants to bill insurance and doesn't really care about you. They don't care about you.
Or apparently
they don't want to take you because I'm not getting paid what I like to get paid. You have to pay full price.
Yeah. So, nor does that pediatrician like math, apparently, right? They don't like to make more money. So I'm going to lump three things in the box together. You talked about, you've got some direct contracts. You talked about the bundled arrangement, and you talked about the physical therapy. So to box that, right? These are all very, very high quality healthcare providers. And in those scenarios, you have direct means. So you're not going through an insurance company. There's a relationship between that says, hey, I'm going to send my people to you. You're going to do a service, and we're going to pay you something. And theoretically, you are still saving money. So I want to kind of back up and say, okay, these are high quality people. So you're not sending somebody to the Cockroach Motel where they're giving them a bottle of tequila for their anesthesia. They're going to those people that are having really high results. And you're actually, if I know how your plan works, you're waiving their cost. So the employees aren't paying anything. Again, HSA rules applied, right? So there's some sort of incentive. Talk to me about that notion of, wait a second, better quality healthcare is actually cheaper and can benefit both the employer and their employee. Talk to me about that notion, because that seems like you're pushing on both sides of the whack-a-mole. Shouldn't one of them come back up?
Yeah. And, if you're going to get into the real finite weeds and make sure that you have to have an ROI on every tiny decision, you are going to spiral yourself out on all of these things. We're in a game of trade-offs. And what I'm competing against is in the status quo. So for that bundled surgical, we incentivize, we put money into people's HSA if they go there. Is that above our reference-based price? Maybe.
Right.
But what I do know is they're going to be well taken care of. They're going to get a quality outcome. They're not going to get a balance bill, and we're going to be done. And did it beat the status quo? By far, by 40 to 50%. So in the trade-off, so if you look at the trade-off compared to reference-based pricing, you might get bent out of shape that your incentive, you lose. There's no return on that investment. But that's the wrong trade-off. The trade-off is against the status quo, and we're still winning. And we have a better employee experience, and
which can't even amount in the dollar framework of anything. You have an employee who says, "Man, I am really proud to work at Connor Insurance."
Yeah, and they're like, "This is a really good benefit," and that's the thing that I think that a lot of employers can't, unfortunately, spend all this money, and they're afraid because they're afraid of people saying like, these benefits stink. And it's like, you know what? They're already saying your benefits stink.
Right.
It's just comfortable. Your benefits are comfortable and they stink.
Right.
So going out and trying to build your own performance lab, is simply stepping into a realm in which you can actually get a win. Hey, this is a great benefit, And people just really don't hear that much anymore.
So in all of those instances, your employees are rewarded. They pay less. You, the plan, pays less. On the flip side of that, you're sitting down and you're having a conversation with that PT, that doctor, that surgery center. Talk to me about their angle of that too, because why would they do something like this? So somebody might be looking at it and be like, isn't that what the major insurance companies do? Aren't they happier in that scenario? Talk to me about that side.
Short answer, there's a documentary coming out that will explain explain exactly how it works. But in that environment, there is just so much waste in the system that there's a business model that exists. There's a supply chain that exists where these services can be performed at a fraction of the cost. So we're just simply plugging in things that we know will be workable within our ecosystem. Again, that fertile foundation, that fertile ground where we can plug in and find success, right? So, and you talked about the box, and I think that's an interesting analogy because it is a box. We can know, we see so many health insurance claims and otherwise, we can know where our biggest risks are, right? So simply, what we need to do is solve for them. It's really not that complicated. You have dialysis, you have NICU, you have cancer, you have, general infusion I mean, the list isn't that long of major claims. So managing the supply chain of those sorts of things. And then we have the employee satisfaction and the demand side of healthcare and making that enjoyable. So if we really think about the box and how to reconstruct this thing so it actually is workable, we can really move out the noise and really focus on just plugging into the fertile ground, the things in the box that are solutions that work.
Which, by the way, is the 95-5 almost, right? It's like the 5% of things that are driving so much of a percentage of the dollar amount.
Right.
So I want to switch and end this with third generation agency. You're doing things differently today than you did. I want to flip that conversation of employer education and relationship with employers. And I want that to relate into the documentary that you stated. If you're sitting in front of employers knowing almost 20% of our GDP as a country is spent on healthcare, the second or third largest expense for that employer, employees typically are, filing bankruptcy, can't use their benefits. Everybody's fighting for talent. What a room full of employers, you got this microphone here and you could talk to them all. What do you tell employers as not Ben Connor, the insurance agent, as Ben Connor, the employer and the person that just happens to be doing this over there? What do you tell them?
I tell them, first and foremost, I empathize with employers in the position they're in. The CEO of the manufacturing organization wakes up figuring out how he makes the world better with his manufacturing entity. He doesn't necessarily wake up saying, hey, I want to get involved in healthcare decisions with my employees. In fact, they want to avoid that at all costs. They want their employees to have the best possible healthcare. They want their employees to be well cared for. They desperately want that. They just don't want to be in the position of making decisions for them. But the reality is they are. And as much as you don't want it to be that way, that you just are. So as a leader, we have to take up the mantle. We have to say, this is something that I've been entrusted with, whether I like it or not. And I have to solve this problem in the best way that I think can serve our employee workforce the best. My call to employers as a fellow business leader is what we're doing to our employees right now is not in their best interest. It puts them in harm's way with physicians that they don't know. Simply just not knowing is the problem. Right. Give the employees the information and they make poor choices on their own. And I would like to force you who to go to, but maybe that's not what I feel like I'm called to do. But we can do better. A great example is there was an infusion medication that we recently uncovered in one of the programs, one of our plans, that was trying to be paid at $40,000 every week. And the acquisition for that medication is $11,000. So we said, whoa, we're not paying that.
Right.
So we changed it. And so we're paying a little bit above $11,000 so that, paying the cost of the drug plus a little bit more so they can administer it. And that has to be done. If the employer is not watching, which they haven't been, that's how we get in the position that we're in. But the beauty is, just like anything, when you make a bad decision, you can just make another decision and it can be a good one. So let's just make another decision and make it a good one.
Love it. Love it. And I think I know the answer. The education piece of this is probably the biggest gap, right? Is understanding you are somebody who navigated what I think, I've not seen one, the first behind the scenes, open the kimono documentary in healthcare. Talk to me about the overall gist of the documentary and why did you want to be a part of it, just from a personal and professional basis?
Yeah, I think it just goes back to, I think we need to care for basically the American public better than we have as business leaders. And I think there's not too many things in health insurance that are wildly compelling. So being a part of actually a compelling documentary that tells the story of the business of healthcare and encourages employers that they can do something about it and that we need them, like I'm in on that. And I think, for the most part, there are a lot of business leaders that want to do the right thing. They really want to care for their employees. They just don't know that this is an area in which they can do that better. So we just need to educate and help them see that they are in control and again can make that next decision to solve for it.
Well, what will somebody see if they watch this documentary? What will they see? Give them a sneak preview.
So I got to see an early cut of it. And, I think one thing that hit me, and again, I'm in the industry, one thing that hit me just again is we can say healthcare is broken. And when I think of healthcare as broken, I think of like corporations and greed and that kind of thing. But when I watched the documentary, I saw brokenness and people trying to navigate the system, and brokenness of how it hurt people individually, that could be changed. And that view has compelled a lot of the experts in the film to do what they do now for a living. So I think when we take the brokenness of a system to brokenness among people, that changes the game.
Yeah. Ben, if somebody has heard this, and I'm going to summarize what I think that they heard today. They heard that you can actually deliver better benefits at a lower cost. You can incentivize people to do what they do in every other aspect of their life. P.S. Right? Like I often joke that employers are like, "Oh, my people aren't healthcare experts." They sit on the floor on Sundays and cut 39-cent coupons for lima beans out of the grocery store. And you don't think that if you gave them an option to save $3, $4, $5, $6, $8, $10,000, that they wouldn't navigate their way or pick up the phone or learn something more? So I think we just completely underestimate how savvy the average person has to be in an economy that we're in right now. So I heard that you do this for a living, but you've now turned internally and you've done it for your employees, and you are recruiting some of the best talent. You win all of these awards. That's what I heard today. If someone's listening to this and says, "I'd love to learn from him. I'd love to do business with him. I'd love to watch the documentary," where do they find out more about Conner Insurance and Ben Conner specifically?
Yeah. So website is Conner, CONNER, and then INS.com. Find me on LinkedIn, connect with me there. I'm fairly active on that platform, so that's a good way to engage with me personally. So that's a way to get in touch with me. I think one thing that's really encouraging, really quick to the story that you just mentioned about, I don't know if my employees could do that. My response to that has been the same for now a couple of years. I say, so you're telling me if we put a bag of cash and put $2,000 in it and say, hey, if we told your people that there was $2,000 in a duffel bag in Greenfield, Indiana, it's 50 minutes away, but if it's in Greenfield, Indiana, you don't think your employees would figure out a way to get their rear ends over to pick that up? You are out of your mind. They would totally do it. So, that's kind of my, I totally love it.
I love it. We disconnected if that's what we actually think, right?
Right. Decisions made in a boardroom that aren't necessarily felt to the workforce that they're leading. But I think one thing that's really encouraging to me, we love solving problems with employers, and we've just been continuing to meet employers like, hey, we really want to solve this problem. We really want to care for the employees. I will say this too. There is a wonderful movement in our industry of incredible people that are doing really good things. And what's interesting is we might all do things slightly differently, but we're accomplishing similar objectives. And I think that's really powerful. That should be encouraging to employers that, if employers had to rely on Ben Conner to save healthcare, we're totally screwed, because it's going to take a total army of really good consultants, and there are more and more that are stepping up it's a good community for me too, to iron sharpens iron, of reach out to say, hey, how are you doing this? I bumped into this issue. What are you doing about that? And really helping each other out. So I'm really thankful for that.
Well, you being on this podcast is exactly why we do it. So, it's called Impact Healthcare for a reason, and the people and the strategies that are leading it, and you are absolutely one. Ben Conner, you're an apple in everybody's eye, buddy, and I appreciate you being on and sharing, and I don't care. I'm going to tell this to every advisor and every employer. Ben has never said no to sharpen iron against somebody else. So please take him up on that honor. And just being around him and the grace that follows him is quite extraordinary. So Ben, thanks for being a guest on our show.
Appreciate you, Lester. Thank you.
And for the employers, you heard him. You got to do something. The current market isn't working. The definition of insanity is continuing to do the same thing and expecting different results. So stop being insane. To you advisors, an old dog can learn a new trick. That's all we have to say. It is all ego in the middle of it. And Ben and I are both people that have been in this business. I'm going on 24 years this year, and my world, the last 6 was way different than the first, however many of that math works out. So Ben, again, thanks to the audience. Thank you. Share this, share the love, because at the end of the day, the right person is getting impacted, which is people who are on the front lines, working their tails off. And that's what makes us go to sleep at night really comfortably. So thank you so much for tuning in, and we'll catch you on another episode of Impact Healthcare.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.